promised, I have Alan here. I'm really excited about this because he's taught me a lot already about just body work in general, but specifically what he can do with women and women's health, pregnancy, postpartum, and more. So I wanted him to introduce himself to you. Just tell them what you do, who you are.
Yeah, so Alan Gunther, and I got into this work a while back. My wife and I have 6 kids, and we had 5 of them at home, and I was getting more and more involved with the pregnancies and the labor and the delivery and all that until actually our 5th child, I delivered him myself. And of course, my wife was there, the midwife was there, and but she didn't get involved until afterwards. And I realized that I really had a passion for this kind of work, and so when I started getting into more of the bodywork aspect of things, it was kind of a natural jump over to the women's health and the pregnancy, that sort of thing.
Which is, we had this discussion about how it's kind of uncommon to have a gentleman working with pregnant and postpartum, but I think it really, really works, and you're very knowledgeable, and you really dove into C-section scars, correct? Right? Yeah.
So as a kind of a natural outcome, of course, we're trying to avoid the C-section as a whole,
right?
But sometimes it really is the best solution, and so I realized that I needed to come up with a good protocol to work with the C-sections, not just something that was going to kind of, here's a little bit or there's a little bit.
Right.
We needed a good solution.
Right.
And so it was a number of months ago that I started delving into this deeper and deeper, and I thought I need to practice on somebody. I need somebody to work with, and the first client that I had who kind of fit the bill, she came in to me and she had a C-section. She was pregnant again, and her C-section scar was giving her a lot of problems during the pregnancy, a lot of pain. And so, okay, well, now's the time. We're going to see if this actually works or not. And so we did some of the C-section protocol, or not some of it, we did all of it, and significant results after the first time. Mm-hmm. And she came and see me for 4 visits, and then didn't come back anymore because the problem was solved. We didn't need to anymore.
I like that.
And so and successful outcome. She was able to do a VBAC like she wanted to as well. And so,
that's exciting.
Like, what's to lose? There's just a good outcome all around.
And let's talk about, because I know I've talked about in this group a lot how scars matter, how C-section versus vaginal birth, you're going to have different complications, different situations with each. Mm-hmm. But what happens, and I want you to describe in your mind with the C-section scar, the tissue surrounding the scar can just store a lot of things.
Yeah, so it really depends on the mom and what her body is like, mm-hmm. to begin with. So some women are going to have more intense scars and some are going to have less. They all matter, but some are going to respond differently. So how the scar tissue actually affects. So sometimes the scar itself, like if you're going to have the scar about right here, just above the pubic bone, sometimes the scar itself will just be painful. Sometimes, I'm hoping you can see me here.
I think
but so. If I have the scar right here, this is pulling my chest towards my pubic bone. And so some women are going to describe, my C-section scar is fine, but I feel like I'm pulled forward, and it's really coming from here.
Right.
And so you can imagine if I'm kind of pulled forward like this, what's this doing to my neck? It's like, oh, I have neck pain. Well, yeah, you do, but we need to get that scar tissue released. We need to get it functional. We're not trying to tear the scar tissue. We're not trying to, we're trying to make it strong, but still flexible and still pliable so that it can do its job. But we're not trying to just pull it apart. We're trying to let's work with this so that this is functional now. So it's not just locking down the whole area.
Which, I mean, scar tissue itself, it's serving a purpose, right? The body was like, hey, we're going to help you out. Let's give you a little bit of extra help around this area that's had trauma. Mm-hmm. So by working it, and like you say, the pressure release from the neck, sometimes low back, mm-hmm. all these different circumstances coming from this one scar can be very significant. And have you found any difference, because this is my personal curiosity, I've had a couple of patients with higher scarring, like the higher cuts, and then I've had one individual that comes to mind, hers was super low. It was the lowest I'd ever seen. Have you ever noticed a difference about where the scar is in relation to the pubic symphysis belly button? Like,
so yeah, there's going to be differences. The location, it's going to matter, but I don't think it's really the most important.
Interesting. Okay, I was curious.
What will happen with a scar tissue loves to attach to bony surfaces, and so if it's closer to the pubic bone, it's going to be easier for the scar to attach to that pubic bone. And so part of the protocol of what we're doing, we're going to be doing a couple things here in the office, and one is neurostim, and that helps to change the scar at a cellular level. It makes a huge difference. But then we want to work on it manually. And so part of the manual work is we will actually put some pressure here between the pubic bone and the scar, and we'll be working with it. And then the woman herself will be controlling the level of tension, and like, okay, there it is. I'm gonna work with that, and then okay, that released. I can go a little bit farther now. And so with the location of the scar, yeah, closer to the pubic bone is going to cause that.
Yep. I
haven't found other huge implications of that.
Interesting.
But then another thing. So with this, I think you can see it. We've got the pubic. Whoops.
Ooh. And we lost it. No.
All right. Put my pelvis back together. Here, we don't need these. We're doing the front. So the scar tissue is going to be right here. Well, what's right behind that is the bladder. And so the uterus is kind of retracted back in, and now we have things like frequency of urination because the bladder can't expand because
it's
of the
stuck on
scar
the tissue. Yeah.
Or there's incontinence, these sorts of things.
And I love that because it's not just, I've had a kid, so I'm going to pee myself forever. No, there's other things that we can do, like this. So now let's talk about, because another one that we were talking about that you've been delving into is breast reduction scars.
Yes.
And kind of the impact that you're seeing in the tissues. So talk to me about that.
Yes. So another example, I had a client, she came to me because her neck was hurting. And she'd had migraines, headaches, daily migraines. And so it was really quite intense. She was doing a lot of other things to be proactive about it. But she came to me, I forget how she found me, but she thought I could help. And so I asked her, first of all, have you had any surgeries? And it turns out she'd had a tummy tuck. And which that scar is going to be a lot like the C-section scar. So the C-section scar is usually just a little slice across here. The tummy tuck is often from this bone here to this bone here, all the way across, and they're doing things underneath as well. And so it can be pretty major. And so when she said I've had a tummy tuck, I was like, yeah, that's probably it. And so we went there, and I'm feeling like, yeah, I feel the scar tissue, but it's not that bad. And she said that she'd also had a breast reduction at this very same time, and they had removed, I think she said, like 1.5 pounds of tissue per side. So that's significant scarring. And so with her permission, we went and started working with that scar a little bit, and found immediately that, oh yes, this is the problem. And so same thing, we did some of the neurostim work, and because we want to actually physiologically change that tissue, but then we want it to release. And so the same principle that we're working with on the C-section scar. And she came back the next week and told me, 2 days after I saw you, my headaches went away. And we didn't do anything with her neck. We didn't do anything with her shoulders. We just worked on the scar tissue. And of course, since then, we've gone into some of that. We've got a bigger, fuller, more comprehensive release. But it really started with the augmentation, or sorry, the reduction.
Which I like that, because it talks kind of about the fascial lines and how it connects everything in. So, the tissue all over is connected. Even though we segment, okay, I have my calf muscle might inadvertently be connected to tissue that's connected to something else somewhere else in the body. And to me, that's a good prime example about how something in the front was really affecting way up in here. It just wasn't affecting right here.
Yes. Yes, it was pulling all the way up, and she doesn't have headaches except when she drinks too much now.
That'll do it.
Her own
Hydration.
So,
That's cool.
So with all of this, now I'm sure that some people are wondering, like, how some women are going to be uncomfortable, with, we're working right above the pubic bone, and but the truth is that you're going to be covered the entire time when we're doing any sort of C-section scar work. You don't have to be exposed at all, and you will feel like, oh yes, this really does need to be done. And the same thing with augmentation or reduction or any sort of breast surgery, any breast surgery scars. You're covered up the whole time. It's not something that you have to be exposed in order to accomplish. You're gonna be comfortable.
Well, and that's a good thing to know, because some of us are not in Tulsa. So if you find a skilled practitioner, they're going to have the knowledge and the education on how to properly work the area without making you feel uncomfortable. And also having that dialogue. Not just being like, oh, hi, we're here.
Yeah. Just
having that conversation. So it makes you feel more comfortable. And I know I've come to see you, and I felt perfectly comfortable because you explained exactly what was going on. So that really does make an impact. That really does help. Okay. So we've talked about C-section. We've talked about breast reduction. I did, because I've had a couple people in this group ask about endo, PCOS, ovarian cysts, all that stuff. And I was curious what a body worker, because you're so many different things, but what your take on that, those conditions or that situation would be.
So I've worked with that a number of different times, and sometimes we have had very, very significant success, and sometimes it's been less success, and it really depends on the woman, her body, what's going on with it. And and one of my clients, she came to me, she's younger, early 20s, and she'd had multiple endometriosis surgeries.
Right.
And to her explanation, it didn't really help. And so I went and I started. So let me explain kind of more specifically where we're going to go when we're doing this, because obviously, it's this section right in here that the most of the trouble is it can spread, but this is where we're going to start. And so she's going to be laying on her back, and this bone right here, we're just going to slowly sink inside the hip and see what is going on here.
So kind of like here, and then following it.
Yeah.
Yep.
Yeah. So we're gonna ask this to open up, and what we're gonna find is that some of the tissues are stuck together. In her case, I think her surgeons actually did a very good job of what needed to happen, but she was super stuck in her fascia right here. So we freed things up. We got her bladder moving again. We got the tissues moving. We got some room and some space.
Right.
And then we asked these, just, can you all lift up here? And we did that, and that's when it just like, I don't know how to explain it, just like the whole thing just let go. And so she went from being in bed for like 3 days during her monthly cycle to, I had a little twinge and I didn't even need Tylenol. So it's kind of, so of course we're talking about the good stories,
right?
And but that can happen, and generally we get good results even working with that sort of thing. Now we want to address other lifestyle issues. Of course, it's not a one problem solution.
Yes.
Or one solution problem, but
I like that because usually with these conditions and with the trouble that we find here, right? There's a lot of stagnation. There's a tightness, and then the feeling of tightness and stagnation that they have towards that area, and so influence it with even just that manual therapy, releasing the tension, releasing the tightness, the lifestyle choices. Getting a better connection with that area, which I think touch helps with a lot. It's just amazing what you can see and the benefits that you can experience, for sure.
Yep.
All right. So, anything else that you want to talk about?
So let's talk about when things have not gone so well. And and the truth is, I've got a particular client in my mind, and we talked about diet and her diet, like vegetables. No, we eat out all day, every day.
Yep.
And so things like that. So when a woman is proactive with her health, I'm doing this, I'm eating properly, I'm exercising properly, I'm trying to do all these things. Well, I might be the missing piece.
Yes.
But if you're like, I just eat McDonald's all day, every day, or Burger King, whatever, and I've got all this inflammation. Well, we're fighting an uphill battle then.
And so I've worked with a couple of patients with endo and with PCOS and things of that nature, and it's always interesting. I refer back to Jessica Drummond. She's a physical therapist who's written a couple books over endo. She's very knowledgeable, and she talks about it. It's kind of that multi-dimensional, multifactorial approach. Because if you are, like you say, you're lacking and maybe you're exercising too much, you're like trying to get it in there, it's like beating a dead horse, and you're stimulating too much stress, too much cortisol. It's interesting because your body will respond in kind, and it won't have those favorable results. But she talks a lot about, you're hydrating your tissues properly, your nutrients, and that deflaming the gut, deflaming the body, getting the proper body work or something of that nature, getting the proper amount of dose of exercise. All these different things can really have an impact on that condition.
It can. And when the most important thing, like when we're getting good success, it's not that I'm doing something to the body, I'm doing something with the body. And so we really want that the body as kind of a community. We're all doing this together. And so when a woman is proactive with her health, that makes a huge difference.
Yeah.
And so, and it's, age makes a difference too. And lifestyle choices and past traumas and all these things, they matter, but the most important thing is, are you proactive with your own health? And if you are, you can be in your 70s and we're going to get good results.
Yeah.
Or you can be in your 20s and eating badly and sitting around all the time, and we're going to get less results.
And
so
I think
age is not the only thing.
That goes back to the breast reduction and the C-section too. Because sometimes if people have those other lifestyle factors, they're not going to get the results around their C-section scar that they want. They're not going to see those different things happen.
Yeah.
Because it does take kind of that, okay, we're in this, let's take that proactive approach to see the things that they want to see. For sure.
Exactly.
Anything else that you would like to add before we let people go?
Well, I think it's been good.
Okay. We'll try to do this again. If you have any questions, drop them in the comments. Maybe we'll do this again if we have some more questions. We'll also upload this onto YouTube so you can check it out there. And yeah.